According to the National Institute of Mental Health, 7.1% of adults in the United States have had at least one major depressive episode. A recent study done at Boston University found that levels of depressive symptoms have tripled since the start of the COVID-19 pandemic. Severe untreated depression has a high mortality rate due to suicide. People with depression often struggle to get help because of the stigma related to mental illness, lack of access to mental health care, and lack of knowledge about mental illnesses and their treatments. The good news about depression is that it is highly treatable. Welcome to Mental Health Collaborative, a nonprofit organization dedicated to educating our community in mental health literacy. We believe that a foundational education about mental health promotion and understanding mental health and mental illness will lead to more resilient communities and decreased stigma. We believe that mental health literacy is a right and need of everyone. Thank you for joining us. Depression can sneak up on us, and it is very different from the normal lows that we all experience as a part of life. Sometimes it can be difficult to recognize depression, especially if signs and symptoms creep up gradually. So what are the signs and symptoms of major depressive disorder? We often clump signs and symptoms together, but they are different. Signs are what other people can observe, for example, staying in bed or crying, while symptoms are entirely subjective and not seen by others, for example, feeling worthless or hopeless. With depression, most people experience a number of signs and symptoms, but when a person can hide the signs and put on a happy face, but is suffering greatly inside, this can be dangerous, especially if the person doesn't understand what's happening or why they are feeling so awful, and they don't seek professional help. If no one around them sees any signs of depression, then that person may feel very alone and hopeless. That is why it is so important to check in with family, friends, coworkers, teammates, and neighbors. We never know how one act of kindness or a caring gesture can change things for someone who is struggling. Some of the common signs and symptoms of major depressive disorder to look out for include loss of pleasure in those things usually found to be pleasurable, a sense of hopelessness, inability to concentrate or retain information, changes in sleep or appetite patterns, social withdrawal, and thoughts of death or suicide. These symptoms and signs usually occur for most of the day for at least 2 weeks, and usually impair your ability to do things that you normally do. Depression is most usually treated with a combination of psychotherapy and medication. One type of therapy that works well is called cognitive behavioral therapy, or CBT, which focuses on changing our thought patterns. One of the most common medications for depression is a selective serotonin reuptake inhibitor, or SSRI, like Zoloft or Prozac, which alter the levels of the neurotransmitter serotonin in our brains. Some things that can improve depression, but do not substitute as a treatment, include exercise, a healthy diet, and time spent with loved ones. Meditation, being outdoors, and trying to engage in things that normally bring us pleasure have also shown to improve depression, alongside of medical treatment, that is. Of course, when someone is trying to recover from and getting treatment for depression, it can be hard to push ourselves as we normally do, so it's also important to treat ourselves kindly. If we were just recovering from a heart attack, we wouldn't expect ourselves to go run 5 miles. Just as if we are getting treatment for depression, we also have to take it easy and expect less from ourselves initially. What causes depression? The short answer is that we don't know, but it is a complex combination of genetics and the environment. Both our DNA and our life circumstances can affect our mental health. Sometimes people have one depressive episode, recover, and never have another one. Others may struggle on and off with depression, going through periods of therapy and medication, and other periods where they don't need treatment. And sometimes people require being in treatment for depression on an ongoing basis. Now let's clear up some common misconceptions about depression. If we are diagnosed with depression, we can still experience happiness and be a mentally healthy person. Depression does not mean that we are always sad or gloomy, And although the treatment can often take 2 to 3 months to work, it is very treatable, and people with depression usually recover and live successful and productive lives. Depression is an illness, not a sign of weakness, and it does need medical treatment. If you or someone you know is struggling with depression, see the resources below for how to get help. We hope you found this information helpful. We at Mental Health Collaborative are committed to providing education and increasing awareness about all of the interrelated states of mental health. We hope that by doing this, stigma decreases and more people get proper treatment and support for mental illnesses. Learn when to get help, where to get help, and what to expect when they get there.